been 6 days now since nearly 800 nurses, technicians, and technologists last worked at Lawrence Memorial Hospital in New London.
News 8's medical reporter Jocelyn Mementa is in our newsroom now with the very latest on where things stand and how patient care is being affected. Jocelyn.
And Darren, what began as a 4-day strike led to a lockout over the weekend. Michael O'Farrell, the spokesperson for the hospital, tells me the move was made because of intermittent threats of a possible walkout during the holidays, but says the other night that both sides had probably the most civil conversation to date. Union leaders say they too want to get back to work, but says the hospital's decision to move services off the campus is illegal and led to the unfair labor practice strike.
In any industry today, I challenge you to find somebody that has 100% job security. Healthcare is dynamic. It's changing rapidly. We're trying to change with it.
The biggest issue, the biggest sticking point we have is not 100% job security, as the hospital will have you believe. What it is we want to be able to follow the work and take care of our patients.
Patient care is the #1 concern for union members and hospital administrators. Plans were already in place before the walkout. The hospital lowered the patient census. Temporary employees were brought in so that there was adequate staffing for the patients who are in the hospital.
Outside, nurses, technicians, and technologists walked in solidarity, locked out of their jobs. The quality of patient care weighing heavily on their minds.
We're concerned because there's 800 of us on the street and there's only 150 or 200 of them in there. So we're really concerned about the patient care.
Inside Lawrence Memorial Hospital, Dr. Robert Linser, chief of surgery, is keeping a close eye.
I've been here throughout the weekend because I was on call, and as I've made rounds, administrative nursing personnel have been here for the handoffs, making sure that any problems are being taken care of.
Elective surgeries are still at less than 50%, but will be back on a regular schedule by Wednesday.
We're working with what we have. We have plenty of OR staff. We have plenty of ancillary staff.
Still, people in the community are not as convinced.
You'd want to have everybody staffed that's supposed to be so that you get your accurate care in a timely manner. I mean, we have problems with the wait as it is sitting in the hospital.
Bill Lacey and his wife, regular visitors to the emergency department at Lawrence Memorial, were forced to make changes.
Yes, so we have to try to make an appointment with our regular care physician, and to try to get into a regular care physician, it can take up to a week for an emergency even, and go into the emergency room. They don't have the care facilities necessary for her type of illness. She has COPD.
If you need to come to the hospital, care is uninterrupted. I've been in the emergency room. Emergency services are excellent. Our emergency staff is there, and care has been unchanged from what would happen before and what will happen after the strike.
Meanwhile, the two sides are meeting tomorrow at 11 a.m. We will keep you posted on the latest developments. Ann?